Welcome to the show, everybody. I said yesterday, which was our first show of the year and the first show of the week, that as soon as we had kind of catch-up data from the holiday weekend about COVID, we would look at the numbers and that it's expected that the numbers are off the wall, shocking, appalling numbers. And indeed they are when it comes to cases. The numbers are appallingly bad when it comes to testing in terms of the difficulty of getting a test and the extremely high positivity rate of tests, showing how incredibly widespread this Omicron variant is. But we continue to see death numbers that, while they are still tragic, are making us hopeful that this Omicron variant is going to burn through the population in maybe the next 4 to 6 weeks without a proportionately high death toll, and then go. Now, what happens after that? There are 3 or 4 different perspectives, which we will eventually talk about. But let's take a look at the numbers, and they are just incredible. How contagious this thing is really, really hard to believe. In the United States now, just a vertical increase, and we'll look at the exact numbers. If you look at the day by day, days of nearly 6 consecutive days of nearly 600,000 cases in a single day. And a lot of the backlog data is still being cataloged, but these are incredible numbers. At this point, if we have 500,000 cases a day that we know about, we would expect that the real number of infections is between 1 million and 1.5 million actual infections a day, to account for home tests that don't show up in these data and to account for people who never get tested. 20% positivity rates in many states and big cities. If we look over at, this is death. Let's not go there yet. If we look at global cases, we see that global cases are now reaching 2 million cases a day that we know about. And with the difficulty of testing that also exists in many other countries, some countries have great testing, some countries don't. We can also safely estimate the real number of infections. If officially it's 2 million cases a day, there's probably between 4 and 6 million infections per day, or even more. If you think about just the U.S. numbers, actually, but before we get to that, article from CNBC. U.S. reports over 1 million new daily COVID cases. The U.S. has reported a record single-day number of COVID cases with more than 1 million new infections. A total of 1.02 million new cases were reported Monday yesterday, per Johns Hopkins University, as the highly infectious Omicron variant continues to spread throughout the country and beyond. The U.S. also has the highest 7-day average of new daily cases in any country tracked by Johns Hopkins. This brings the total confirmed cases to 56 million, over 827,000 deaths. Now, the record single day total may be due in part to delayed reporting from the holiday weekend. So that's what's really important to look at. When you might be saying, David, wait, so if 1 million were reported yesterday, why does a Worldometer say that it was only 426,000? 1 million were reported yesterday. Some were from January 3rd, some were from January 2nd, some were from January 1st and December 31st. So we're rapidly getting up there. For a moment, let's imagine that the real number of cases, just to make the math easy, is 1.6 million a day. Why do I pick 1.6 million? Well, the U.S. has a population of about 330 million. So 1.6 million, 1.65 million would be exactly half of 1% per day. If you start doing the math and you think about, well, some people, if you have 3 shots of Moderna or Pfizer, you're about 75% protected from symptomatic infection. So when we think about the population, if there's some people who have recovered from prior COVID and have protection, some protection from Omicron, it's diminished, but some protection from Omicron. You have some people then who, even if exposed, aren't going to get it. You then have people who have 3 shots, which gives you some significant protection against Omicron, although vaccinated people are getting this all over the place. We know that. So you've got that population. And then if every 2 days, 1% of the population is getting it, you start doing the math. 30 days of this high case rate is going to have most of the country exposed. Many will get it. Many will be asymptomatic. Some will be exposed and fight it off thanks to vaccination or prior immunity. In 30 days, there can only be one path for Omicron, and it's down very quickly. And we're seeing that in South Africa. Now, could there be another variant? Of course. Could there be all sorts of different things? Of course. But when you have something this contagious, where every 2 days, 1% of your population is getting it in a country this big, and you have some immunity in the population, and you have some vaccine protection in the population, at some point, something has to break. And so the cautious optimism is that this will get us much closer to the end of the pandemic phase. What about deaths? The good news continues to be that deaths are not spiking. The Omicron spike in cases started right around Thanksgiving. And while there has been an increase in deaths, the average daily going from about 900 up to about 1,300, cases are dramatically higher, and the deaths are not yet spiking. And it's been a while. We're into 5 weeks now. In South Africa, Omicron led to a case increase of 150x a day, 150 times increase in cases, and deaths only doubled. Now, South Africa is different in a lot of ways. Much younger population than the US, as I said yesterday, et cetera, et cetera. But the fact that deaths are not spiking in proportion with cases is very good. Globally, deaths continue to decline. At the start of the Omicron spread, global deaths were at about 7,000 a day, and now global deaths are under 6,000 a day. We're cautious. We're cautious, but this is reason to be cautiously optimistic. One last thing on this. The CDC has shortened the waiting period for Pfizer COVID boosters to 5 months. Remember, the CDC had said, get your third dose at least 6 months after your second dose. Now the CDC is saying 5 months. And it is believed that part of the reason is that that third dose is so much more effective at preventing symptomatic illness from Omicron that the recommendation is changing. So that is a very good thing. These are the numbers as we have them right now. We're going to continue to follow them. It's both appalling, the difficulty of getting tests and the number of cases. It also is a sign to say, wow, if cases are this high and we're not seeing deaths spike dramatically, that's a really, really good sign. We will follow the science. One of our sponsors is Magic Spoon breakfast cereal, sweet and tasty like the cereals I loved as a kid, but without the sugar or the carbs. Every serving of Magic Spoon has 0 grams of sugar, only 4 net carbs, 140 calories, and packed with 13 grams of protein. Perfect if you're doing keto, perfect if you're doing low carb, great if you're just trying to reduce your excess sugar intake, and because it's packed with protein, it's great before or after a workout. Magic Spoon flavors include cocoa, fruity, frosted, peanut butter, blueberry, and cinnamon. They're bringing back cookies and cream. They're bringing back maple waffle. You can build your own variety box and try them all. Magic Spoon is so confident in the product, if you don't love it as much as I do, they will refund your money, no questions asked. Go to magicspoon.com/Pacman. The link is underneath this video, and you'll get $5 off when you use the promo code Pacman at checkout.